In this session, we are going to talk about some of the many different career paths that you might encounter in the field of neuroimaging. So this slide here is mainly pertinent to the United States. It might be similar in other countries, but some of the details vary. We are working on having some of our collaborators around the world put together edited versions of this for their own country. But for the time being, this is just the United States represented. And here we are laying out some of the many different career paths that all might fall under the general realm of neuroimaging, either neuroimaging in what you use or neuroimaging in what you studied. So we're going to walk through some of these. There might be some exceptions to this, but for all of the examples that we could think of, a college degree is required. So an undergraduate degree is required, and all of these assume that you have that. After college, there are a few different options. Many people, myself included, go to work in a lab or work in industry as a research assistant or a research tech before then applying to graduate school or medical school. And then for school, for post-undergrad options, generally when we're talking about neuroimaging, we're talking about two types of post-undergrad options: medical school and graduate school. And graduate school, I'm talking about generally, so including both like neuroscience PhD programs and clinical psychology PhD programs, but generally PhD scientific programs. So some differences between these. Medical school is 4 years long in the US, plus there are years for residency, for fellowship. There is extensive pre-med coursework that is required, and the MCAT is a required standardized test that you must take to apply to medical school. Tuition averages $50,000 or $55,000 per year in the US currently, with some exceptions that we'll talk about. Graduate school. The length of graduate school varies. This depends on how quickly you get through your coursework and how long your thesis, research, and writing takes. But typically, this is a 5 to 6 year program. The coursework that is required varies by your program. And depending on what you want to do, you need to look and see what universities offer that option. So I have a PhD in neuroscience. Neuroscience is not usually a department. There is not a department of neuroscience. Most schools that have a neuroscience program have a interdepartmental neuroscience program. So this might pull from psychiatry and neurology and biology and computer science, but there is not a neuroscience department. The other option for graduate school that we're talking about here is a psychology PhD. Generally clinical psychology PhD is what we're talking about here. Or experimental psychology. So these are the two options. This third option here is to do both of them. MD PhD programs, these are typically 2 years of MD, then your whole PhD, and then 2 more years of your MD. So often this is like an 8-year long process or longer. But for a number of MD PhD programs, the tuition for your MD is waived if you're in this program. So next steps, we're going to start with medical school because it's a little bit simpler in terms of what the next steps are. After you graduate medical school, you are a doctor. The vast majority of medical school graduates go on to do a residency so that they become board certified in a particular specialty like neurology or pediatrics. But there are options straight out of medical school. Some people go straight into biotech or tech or straight into pharma as scientists, as advisors. From residency, there are lots of options. Clinician scientists. So this would be somebody who has an MD, but they are doing clinical research. They're doing research potentially in humans, potentially in animals, but they're doing research as opposed to seeing patients directly. Clinical care is another option. This would be your standard, what you think of as a doctor seeing a patient in an office. Biotech and tech and pharma are, of course, also options. and consulting. This is fuzzy because consulting is kind of fuzzy. There are proper actual consulting firms that people might go work for, or it could be consulting on a book or a TV show or a movie or something that uses medical knowledge and wants to actually have an expert to inform that. Moving up here to graduate school. So this track right here, I'm thinking of like a neuroscience PhD program here. So after finishing a neuroscience PhD, you might go on to do a postdoc or a postdoctoral fellowship. This is a position that can vary in terms of length, but it's in between graduate school, finishing your PhD and going on to the next step. And this is when someone has more independence, they're starting to grow as an independent researcher, but they still have an advisor. They still have a mentor, a postdoc mentor who is guiding their research. After a postdoc, you might go on to become a professor or a research PhD. This could involve teaching, it could involve mostly research, but working in a university or working in a VA as research faculty, or in a private research firm, those are all options here. This would be considered the most traditional academic path, PhD, postdoc, faculty, but it is certainly not the only path, and it's not the best path for everybody. So it's important to highlight the other paths that are becoming more and more common. Many people go on either from their postdoc or directly out of graduate school to work in biotech or tech. And you might think, why would Twitter be interested in someone with a neuroscience PhD? It's not the neuroscience that they're particularly interested in. It's the scientific knowledge, the understanding how to work with data and extract meaning from that data. So I have colleagues from my graduate program who are working as data scientists in various tech companies. You might also go on to work in pharma, a pharmaceutical company. I have colleagues from my graduate program who are working at Amgen, for example. And of course, consulting, again, using that scientific knowledge to guide policy, to guide portrayals of science in the media. This other path right here, internship fellowship, this thinking mainly of clinical psychology programs, where after graduate school, you go on to do an internship and then a fellowship. You can then go on to become a clinician scientist, where you are a clinician, you can see patients, but you mainly are doing scientific research, just like this medical school path here. You can also go into clinical care, which is like a psychologist who sees patients in their office for individual or group therapy. And of course, can also go from clinical psychology programs or internship into biotech, pharma, and consulting. So there are lots of options here, and these are also not your end options. Many people leave academia and decide that they want to go into biotech or one of the others. Same for clinician scientist and clinical care. In theory, you can also go back from these to a research PhD to a faculty position at a university. In practice, this is often harder. It shouldn't be, and I think it's probably becoming easier, but this is less frequently done in practice. It's usually more one direction. So there's lots of arrows here, and so to some degree, what you should take away from this is where the arrows are not. So for example, if you have a PhD in neuroscience, you cannot do clinical care, and you are not a proper clinician scientist. You're a scientist, you're a research scientist, but not a clinician scientist.